This was a large study with the collaboration of 17 different partner institutions looking at the commercially available Myriad Prolaris test to see if it could prognosticate metastasis in men undergoing radiation therapy, but also radiation therapy combined with androgen deprivation therapy. And very specifically, what we were trying to do is see if this test could be used to help inform patients and their physicians as to whether or not they may be able to omit the routine use of androgen deprivation therapy along with radiation treatment, which is currently recommended for all men with what is called NCCN intermediate and high risk prostate cancer. And really the notable finding of the study was that we were able to validate a threshold score, something called a CCR score, that we had previously determined in a development study. We validated that it was a exceptional prognosticator of metastasis in men undergoing radiation therapy with or without ADT, and that this threshold could be used to have a discussion with men about who it would likely be safe to omit ADT with the radiation in. I think that for my colleagues, there's been such a care standard for really the last 20 years that looks at men with intermediate risk and high risk prostate cancer, where it's just kind of insisted that you use ADT with the radiation, that they're a little bit uncomfortable looking at sort of new information that incorporates molecular information as to really, can we move away from this care standard? And so I think that the questions that they tend to ask me are actually like, how comfortable are you doing it yourself? Have you changed your own practice integrating this test? And the short answer is yes. I think that at this point, we have a development study that had about 718 patients in it where we identified the score threshold.